Question, please.
Yes. My understanding is that Medicare will probably be going broke in the next 5 or 6 years. I understand the bill that they have now talks about reforming Medicare, but the only thing I heard was that they hope to do it by cuts back on fraud. Won't you need to be more specific as to what you plan to do to control Medicare costs?
The reason that you have difficulties right now is that we have uninsured. And because we have uninsured, the cost gets shifted to those of us who do have insurance, and it gets the money has to go into the insurance premiums that are going out there. Medicare actually needs to be expanded, and if we expand it, then it will bring the cost down because we'll be getting with the kind of volume and the kind of savings that we need to have out of it in order to make it work for everyone.
Medicare has a program called Medicare Advantage that is run by the private insurance companies, and one of the ways that we are going to strengthen Medicare is to eliminate overpayments for Medicare Advantage. And these are overpayments. We call them overpayments because the seniors under this particular program are not getting any additional benefits that other Medicare recipients get. And so the taxpayers of this country are overpaying under this program to the tune of close to $177 billion that we could save over the next 10 years. So that's one of the ways that we are going to cut costs and make Medicare stronger.
Yeah, my question is, like in Hawaii too, we have the insurance, the state insurance trying to shift over all the prescriptions to a Florida company, and you know when they do things like that, you really make the local business people suffer because they don't have enough volume of sales, and also they're gonna have like the Florida people, they're gonna cherry pick the medications that they're going to be providing, and what's going to happen is the local companies are going to get stuck with all the ones that they don't want to supply, and you know, for them to keep inventories and for them to supply the people with medications is going to be a burden, and also the quality of the care where you don't have the one-to-one explanations like you're going to have if they need some from the pharmacist.
Okay, Dean, you're worried about the prescription drugs purchases being done out of state. Is that your question?
Yeah.
Okay.
This relates to what the retirement, this has to do with the retirement board, the EUTF, trying to bring down the costs. The reason they have to do that is we don't have a national system. That's what the whole problem is here. We have a creaky, we have a system that the Prussians would have gotten rid of 2 centuries ago. That's the reason. I mentioned it before. You can't have private insurance companies operating for their own profit, for their own benefit, and expect to have the kind of service that you're talking about locally. That's why they're shifting it. The costs have gotten out of sight. So the board felt they had to do that to bring costs down. I'm on your side on this. If we had national health insurance the way we should have, then we could service everybody locally the way we should. So that's one of the reasons that I'm for universal health care insurance, and I'm pushing for the public option so that we can make sure that we can handle everybody locally, service them locally, make sure that our businesses and the customers that they have, the patients that they have, are able to deal with each other face to face as we should.
I can only add to that this is really a reflection of the out-of-control rising costs in healthcare insurance and the fact that our programs have to look to any way to decrease costs, and one of the effects will be that more of us are being told that we should get our medication by mail, or that we should turn to generic drugs, which is okay as long as they truly are comparable to the drugs that have been prescribed to us. And this is why we need, as Neil said, national reform. This is not a state-by-state issue. We know that these huge insurance companies and the huge pharmaceutical companies operate nationally and indeed internationally. So our response to how to decrease costs to all of us is has got to be a national approach. But what we're doing is not to take away the current coverages that people have and that they are happy with. We're trying to provide choices, and that's what the public option is all about. And the insurance industry hates the public option because that is the one thing that is going to force them to compete.
Kenneth, you have a question for our Congress members.
Yes, thank you very much. This bill, as I understand it, has got some 1,000 pages or more, whatever. And I suspect a lot of the problem, and I know a lot of the problem in this country, is because we have these groups. We got AARP, we got young people, we got old people. Why don't we include everybody under one plan? And this includes Congress and the President, and quit giving special privileges to this group or that group or the other group, and treat us all as equal. I think the Constitution says we are equal. Thank you.
I couldn't agree more.
That's exactly what we're doing, and there are no exemptions in this bill for members of Congress. We are really working toward making sure that every American gets health care. There are some 50 million and rising people in our country without any health care at all. Many of them end up going to the emergency rooms where that cost is spread to everybody else.
And I agree that the bill is way too long. The original prepaid health care bill here in Hawaii that we passed in the early 1970s it states what its object is very, very briefly, states how we're going to do it, and then leaves the implementation to be worked out rather than trying to draw it all into the legislation. I'm for, when I get back, one of the things that I'm going to be advocating is that we, in a sense, start over again and simplify this and get back to basics. Dealing with Medicare, dealing with affordable health care choices, and dealing with public health and workforce development. That's what the bill is supposed to be about, and that's what we should be concentrating on. As for the 1,000 pages, believe me, we've been through it. Mazie and I have sat through caucus after caucus after caucus in the Capitol, going over the bill page by page, section by section, working it back and forth, and over again, at least the conclusion I've reached in is that we need to simplify, get the principles stated, and let the process work itself out by having the national option, the public option. Once you do that, you take the overhead out of it, you take the profit incentive out of it, and everything becomes a good deal more simple. The proof of that is very clear. Medicare administration is about 2–3% of the expenditures. When you get to private insurance, it can run from 25 to 35% because they're skimming the money off the top in phony overhead and administrative costs. So we can bring these costs down. We can simplify this bill. We can nationalize it as it should be done. No one should be deprived of health care in order to benefit a private corporation.
I sit on one of the 3 major House committees that has jurisdiction over this bill. The committee is the Education and Labor Committee, and we marked up, meaning we dealt with this bill and all the amendments over 20 continuous hours. That's some kind of record. And I proposed an amendment which was ultimately adopted by the Education and Labor Committee, and it is an amendment that will exempt Hawaii's prepaid health care law from this federal legislation if such legislation were to pass. And this is in recognition of the fact that in Hawaii, hundreds and thousands of people, full-time employees here and their families are covered under our prepaid health care law, making Hawaii one of the healthiest states, if not the healthiest, in the entire country. And we want to protect that. We want to give Hawaii the option to decide for itself whether or not it wants to continue to stay within the parameters of our prepaid health care law or to go to the federal program, which, by the way, the federal option doesn't even kick in until 2013.